And these days, we have Dr. Ian Armstrong in with us today. You're going to see him later on this afternoon on The Doctors, but we have him first here on our show. Doctor, thanks for being with us today. Sure. You know, I just can count off the top of my head so many people I know that deal with back pain and back problems. First of all, what, in your experience, has been the most common cause for that people suffer from?
Well, first, I think back pain is the most common ailment known to man, other than the flu almost. 80 to 90% of us will have enough back pain to seek medical attention in our lifetime. And most of it is back pain, back sprain, just strains and so forth. And that's the most common cause of back injury.
And how do you know when it's just a sore back that might go away in a couple of days? How do you know when it's time to go see some professional help?
Most back problems will resolve in a few days, as you mentioned. Maybe some anti-inflammatories, Motrin, Advil, that sort of thing. And after that, if it's not improving, if it's getting worse, then I think you start to need to think about seeking medical attention. I think if there's associated weakness, numbness, leg pain, that's also another cause for concern.
Now, I know a lot of people try to avoid having back surgery at all costs. My brother-in-law went through it, and he tried, because the recovery time can be can be lengthy. But you are working on a new procedure. Explain how your procedure works and how it's better than what we've used in the past.
Sure. Well, first and foremost, only about 2% of people with back problems end up needing surgery. Most back problems will get better with physical therapy, exercise, or chiropractic care. So those few that end up having surgery, some of the surgeries that we use are quite lengthy. The older surgeries go through the back, through the spine itself, work in and around the nerves, go around the important back muscles and break those muscles down. The new technique that I've been working on with a company out of San Diego, Nuvasive, we go in through the side, going through the flank or through the side of the patient. We don't have to work around those big spine muscles. We don't break those down, nor do we have to work around the nerves. And so we can avoid a lot of scar tissue and a lot of post-operative problems.
And how long is recovery time for that compared to the old way?
Well, you'll see the gentleman this afternoon on the Doctors. The individual had surgery on a Monday, and he's up walking around the next day.
Wow.
Yeah.
Dr. Ian Armstrong, thank you so much for being with us. We should point out that you have your office in Los Angeles, but also in Bakersfield. He is a Bakersfield boy, born and raised here, correct?
Absolutely. Highland High School graduate.
Highland High School graduate. Well, we're glad to have you back in town. I want to remind you, too, that The Doctors is on today at 3 o'clock. You can see it over on our sister station, CBS 29. But I want to point out, we had Dr. Armstrong in here first. We'll be right back after a break. Dr.